as I went through medical school training and whatnot, the landscape of medicine was slowly changing, and there were more and more doctors getting employed by hospitals. And so when I was in fellowship and then looking for a job, the narrative that I was receiving is like there's no place for private practice. So that was the whole narrative that I was listening from everywhere.
Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast in which we dive into the realities of healthcare and entrepreneurship. We offer our opinion with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
I'm Dr. Shawn.
And today we have a very special guest. We have Dr. Sweta Goel. She's a board certified neurologist and clinical neurophysiologist. She's also the founder of Prime Neurology in Fair Lawn, New Jersey. And we're so excited to talk to Sweta because not only has she been able to create a practice for herself, we always talk about how physicians used to be owners of their practices, and now we've swiftly become employees. And she's actually doing it. She runs her own practice, and more than that, she's a woman in medicine who's finding a way to make it happen and finding work-life balance. So Sweta, thank you so much for joining us. Do you have anything further or anything I didn't say that you wanted to share with the audience?
Well, thank you for having me here, Santoshi and Shala. I'm excited. No, I think that 1-2 liners, it summarizes it perfectly. We don't need to add anything more there. I'm ready for what questions you have for me.
Awesome. So I'll start by asking you the first question. Can you kind of talk us through your journey in neurology and the medical space, how you got into medicine, and what kind of prompted you to open your own practice instead of staying employed in a hospital system? I know that's a multi-part question, so whatever you want to share, go for it.
Oh, well, no, but everything is so interlinked. So I believe, I am the first physician in my family. So I was inspired by the community doctors in the town that I lived in. And, and I saw how much respect and admiration my family had for them. And I was like, that's who I want to be. And they were independent practitioners. They were doctors we used to go to, and they were our family doctors, and we used to love them. As I went through medical school training and whatnot, the landscape of medicine was slowly changing, and there were more and more doctors getting employed by hospitals. And so when I was in fellowship and then looking for a job, the narrative that I was receiving is like there's no place for private practice. So that was the whole narrative that I was listening from everywhere. And I was like, all right, well, I'll apply for a job, and I'll start there. And I was at a hospital employed position for several years. And life was very stagnant. I was not getting challenged. It didn't seem like there were many more opportunities. It just seemed like life was going to stay like that for the next, 25, 30, whatever number of years I decide to practice medicine. And I didn't want that. And I was like, I could potentially try going to another hospital system, but I was like, that may not be the right answer either. And going back to why I was inspired to be a doctor. So, thinking of all of these independent practitioners, I was, I need to do this. I need to give it a try. And that's how that first thing started. My husband was very anxious about my initial step of like leaving corporate medicine and moving into private. But we did research. We started doing a lot of research, read books, went on to social media forums, connected with people, spoke with other physicians who own practices, spoke with physicians who owned practices and moved and sold off their practices to private equity or hospital systems, and tried to understand their reasons for doing so. and then ultimately made up my mind to start one.
How did you decide on the location and the structure of your practice?
So location, we were sure we are not going to move where we live, so we had to live in this. We the kids go to the schools here, so we didn't want to move. Fortunately, there is a big need for neurologists, so it wasn't like I have to figure out a zip code that has scarcity or whatnot. I mean, it seems like there are 3 months wait list to see someone. So I essentially decided to sublease office space, and then I saw what are my options, and then for subleasing space. And one of the places, so the place that where I first started my practice was Hackensack, which is a big medical center for northern New Jersey. There are 2 or 3 different big hospitals in the area, and there are lots of medical practices in the area. So it just, we started there.
It's so overwhelming. Like, how do you initially start? And you said you started talking to people who were doing it. So did you end up also hiring like an office manager or someone to guide you through the process? Or did you guys kind of just use the physician forums and use your contacts to make it happen?
That's a great question. So I first started with reading a book. This was The Medical Entrepreneur by Stephen Hacker. So I started reading this book and I made notes. And once I had sort of a framework of how to think about private practice through this book, then I had my questions. Okay, what are some questions that are not answered? And this book was written several years ago, more than a decade ago, right? So some things are not relevant anymore, but it gives a good framework of how business entities are created, what do you do, and how do you market and whatnot, right? And some of the challenges that you face and what you do about it. And then once I had a framework, I was able to think, okay, these are my questions that are not yet answered, right? So there are private practice physician forums on Facebook. There's also there are WhatsApp groups of local physicians. Some are employed, some have their own practices, but the questions that I had, some were business related, which any doctor could have answered who owns their own practice, and some were neurology specific, right? So and then once I knew, okay, this is business related, I could ask this from anybody. I would just reach out to people I was talking with at the time, and I would pose my question and try get some leads, and then again do some more research online, and go from there. But that book helped. I think another thing that really helped was the Entre MD podcast. That's by Dr. Una. She's a pediatrician. I started listening to it during my last 6 months of my employed position, and I would listen to it every day going to work, and it helped me get over my fear of marketing as a physician. It helped me get over my hesitancy to say, oh, well, I'm a neurologist. I'm happy to see you as like my office is here. I see da 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 in terms of like, if someone asks me. When I was earlier, I was hesitant. I would actually hide my identity of physician. I would not disclose I'm a neurologist. I would just say I work in healthcare. Like I don't know what it was, but different people have different hesitations, and that was mine. And so I would not volunteer that information. And it gave me, there were some things that resonated with me as I was listening to that podcast, and that helped. What else? I believe there's another podcast that's called Private Practice Physicians Podcast, if I remember right. I do not remember the name of the person who does it, but that helped me a little bit as well. And I also, just heavily utilized connections through the social media forums.
So I'm sure you had a lot of challenges in the first year when you started. Can you name some of the challenges in the first year when you started your practice?
So there were challenges. Thing is, the staffing becomes the biggest challenge. So one of the things that I think really helped me is I did not. I was always like, I have to keep the costs low. And when I say cost low, it's not at the expense of the care is still going to be top notch. I don't need to spend on things that don't matter to my patients. I need a clean office space. I don't need a super fancy office space. I don't need to, I can sublease space. I don't need to sign a 5-year or a 10-year lease for an office space. So that's how I first started. So those were those could be areas of challenges, but we made some choices so that was not a big struggle in this case. My first staff that I hired quit before her first day. The night before she quit, she was going to be my first staff, only staff at the front. I had to hire someone I hired someone within the next 2 weeks. Fortunately, it was someone I knew from before who used to work for the same hospital system but didn't work for them anymore. So it just worked out, and she was looking for something part-time. So, well, it just worked out that she started working for me. And because she had the experience, she helped me set up a lot of the stuff at the office. Also, um, connected me to certain nursing schools that were looking for medical office experience for their students. So it would have been a win-win situation where they could come help out at the office and get their experience, right? So staffing helped. A big challenge for practices is managing forms, intake forms, and whatnot. We automated that. We use technology heavily so that when patients fill out their intake forms, it gets integrated with our electronic health record. So all their past medical history, surgical history, their demographic information, everything, we don't need to manually input them anymore. So it just gets put in directly into the EHR. So that reduced my staffing need because I didn't need anyone to scan, shred, and whatnot.
How many people are you employing at the current moment, like full time?
Now I have 3. One is full time, 2 are part time.
Awesome. And you found them through connections, like the nursing school connections, or did you have to place an ad or scour contacts?
Right. So one thing that I realized was because I automated a lot of this stuff, it was not rocket science for my staff to check in patients. I wore many more hats before, and even do so now, time to time, as the need arises. But if I have to answer any billing questions, sometimes my staff is not able to answer them for the patients. I pitch in, and I explain to them because I understand that better than anybody else now. So I'm able to explain to them as to how their insurance process their claim and whatnot. We hired junior staff. It just, we made, for staffing wise, we keep, we have minimum staff, but, the system is very automated. If sometimes someone has to call out, and if I don't have anybody in the office, I'm still able to run my practice, as it is. I don't need to cancel patients. There are some things that, that get moved over to the next day that are non-emergent, and that is it. Like, it doesn't affect my practice much.
You mentioned billing, that you are able to answer some billing questions for your patients. How is the process with billing? Do you have a billing company? And also, what was the process with credentialing with insurance companies and deciding which companies you want to go with or contract with? And also, do you accept any cash-based model?
Right. Great question. So billing, I outsource billing. I don't have a biller in-house. My billing company did the credentialing as well for me. I did go through 3 billing companies. So I'm on my 3rd billing company, and I'm happy with them now. But it was a journey in terms of like trying billing having a billing company, seeing, okay, this is not going to work out with them. And so moving on to the second one and then to the third one, right? So that was a journey. But the billing companies who were there at in my first 1 or 2 years, they are the ones who actually helped me with the credentialing process as well. You do have to be very, very hands-on in terms of supplying them with all the information they need for credentialing you. So it's not like they can, do stuff. They will tell you, okay, these are the forms that need to be filled out, and they'll fill whatever they can. But I did review every single form that they filled out for me. There were times there were mistakes and I corrected them. I did not just like, trusted, them to like do everything. They're humans and mistakes can happen, and I need to double check. So I would do that. In terms of reimbursements as to what rates the companies are providing, that was a big challenge actually. So there was no insurance company who would tell us as to what they're going to reimburse for our services. And they all claim that there's a way you can get that information, but it is you have to fight tooth and nail. And then they'll be like, oh, someone will get back to you, or in 2 weeks, or you have to submit ABC form, and then someone will reach out to you. You lose your mind in the process and you don't hear back from anybody. And what are you going to do? You can't wait for them forever to credential and get onto network, because you're denying patients until then. So I had to sign up. I got a network. Once I started getting reimbursed, that's when I knew what I'm getting reimbursed from different insurers. And then again, it's confusing because different insurers have different plans and within them, and they all reimburse differently. And they reimburse differently to solo practitioners versus big group practices versus hospital systems. It seemed unfair, of course, that we are providing the same service and maybe better service at a lower cost, but that was a frustrating experience with the insurance companies. And I had to then let go of certain panels after we saw that the reimbursements were so low, we couldn't even keep our costs covered with that. So we do take cash pay patients when they don't have insurance, and they want to see us out of pocket, and that's fine. We have a rate for that, and we go by that.
With some insurances, are you able to negotiate better rates as the years increases or years of practice increases, or that's not the case?
So that's I wouldn't say I have tried a lot, but I've tried once or twice, and we were not able to negotiate because the reason they provided us was we see very few patients to make any difference for them, even if we chose to go out of network with them. Like they wouldn't care if that number of their patients had to look for a neurologist. So the choice was either we stay with them with the same rates, or it would be our choice to go out of network with them. But they wouldn't increase the reimbursement rate just because we have very good ratings, just because we have 5-star reviews, just because our patients are very happy. No, that they would not increase the reimbursement for that.
I think one of the big things that's daunting for people is starting your practice, at least initially, sounds like there's a lot you have to invest, right? Financially, in any case. How did you go about doing that? Did you guys have to take out loans and use other methods until the practice became kind of successful or was bringing in enough money?
So we did not take out loans. I did not. I say we have just gotten into the habit of saying we, but I did not take out any loans. But I kept my cost very, very, very low. Um, we used, so I started working at a hospital a few days a month just before I started my private practice. And because this was a few days a month, it allowed me still a lot of time to work on my practice, which was my primary focus. But the income from that allowed me to offset any expenses that were coming from because of opening my practice. So I did not have to take much out of my savings. That said, it was break even. I wasn't bringing any income home for the first 1 year. It was only the second year onwards that I started taking some salary from the practice. Yeah, keeping costs low was, I believe, it was something that was the most important thing in maintaining the financial health, and not getting stressed by the financial liability of loans and whatnot. But yeah, so again, deciding to sublease instead of leasing, so that was very helpful. Using technology heavily to automate processes, so that reduced my labor cost. Also, me wearing multiple hats. I did not hire for a lot of times. I would answer appointment calls myself in the beginning. I would make appointments. I would, take patients' questions. Now, or I would like have to fax stuff out to other doctors. I did all of that. Part of me also wanted to understand each of these things myself before I hired someone to do it, because I wanted to know what exactly the role required. So I did. Yeah. So to keep costs low, there were certain very specific decisions that we made, but also I wore multiple hats, and I still do wear multiple hats time to time as the need arises.
How do you find that your work-life balance has changed? Do you feel like you can spend more time with your family and children, or do you feel like you can never turn off because you're the face of your private practice and you have to always be available?
No, I think I feel more at peace now. I think the autonomy that this has given me, because I am able to decide what days I work, how many hours I work, the flexibility it gives me, because if I have to call out one day, I do not feel guilty. I don't have a feeling of shame that I'm having to call and cancel. Um, for some reason, it felt that way when I was employed. But now I don't have to do that very often. It's maybe, and these are only during emergencies, but when it happens, I'm able to cancel and accommodate my patients very quickly within the next week or so. So that helps. Because I do part-time hours. If I close one day, I have, because I have clinic 3 days a week. If I close one day, sometimes I'm able to offer another day in the same week, because I just open up another day. So it's been easier on my work-life balance. I think I'm able to spend much quality time with my kids. Um, I think even on days that I do work, when I come back home, even though I'm on call for my practice, honestly, there are not too many after hours calls. A lot of times we make sure that all the refills are taken care of when they come for appointments, so patients don't have to call for that after hours. So there are those things, and we have. If there's an emergency, of course, we are available, but there haven't been too many calls after hours.
So if you have to compare the private practice environment and the employed structure that you were in, what makes the difference between the two that makes your day easier, besides the autonomy? that makes your day easier or less overwhelming? Is it the number of patients? Is the workload? What is it that makes one employed model more challenging than a private practice day to day?
So when it just comes to patient care itself, because I was part of a hospital system, I believe there were some patients who were really, really sick as well. So they had multiple comorbidities. And so there was lots going on with them. And so sometimes, you, even though you have left work, you keep thinking about what's going on, or sometimes you have to send them to the ER right away and communicate with the physicians and whatnot. I don't see that as much in my private practice. I do see that, and I don't know if it's just a sampling bias, maybe because when patients have multiple comorbidities, they tend to seek hospital settings more than individual practices. Maybe it's just a sampling bias. So that's one. Second thing, in an employed model, anybody would text you anytime regarding any patient. So it was almost like you are constantly connected. There was no downtime. I don't, and that would overwhelm you over time. It would take the energy out of you. It drains you because you don't get that time to re-energize.
Has the private practice model changed the way you practice medicine?
Not in terms of care that the patients are receiving. I think that's pretty much the same. They keep them out of the hospital and make sure that getting more outpatient care rather than hospitalizations. It's not good for them. So I think other than that, I really, the way it has changed I practice medicine is just the impact that it has had on me. I think I enjoy medicine more now. I was feeling burnt out. I wasn't enjoying going to work during my last year of being employed. But I again look forward to not practicing, and I'm open for challenges. I like seeing interesting cases, and it's you build up on experience through every case, so it just makes you a better physician.
What advice do you have for other young neurologists who might be considering private practice, specifically women neurologists, since that's most of our audience here, or women physicians rather?
That's a complicated question, right? Because I think private practice is great, but you also have to be curious about how business works, right? And you have to be ready to wear multiple hats. And if you're curious about how business works, how yeah, the hiring, firing, and making policies, and so these are the business aspects of medicine. So if you're curious about that and you don't mind, learning about those things and spending some time doing that, I think you should definitely consider private practice or your independent practice. There are some challenges, but there are also advantages to doing so. Keep your cost low. Really, just spend on things that really bring in a value for your patients. A lot of times, there are lots of unnecessary expenses. For example, building a website and paying a website designer for that. And they can be very, very expensive. But if you can build your own, they're not that difficult. And it gives you the flexibility of changing the material on your website when you want to, instead of being dependent on someone else to do it. I am a big proponent of private practice. I think doctors should do it. They should come back to owning their own practices. I do think that when we are less burnt out, we are able to provide better care. We are able to connect better with our patients. There's a very human nature to medicine, and I think that for that to stay intact, I think the doctors need uh, to be able to enjoy what they're doing to maintain the human nature of our profession. So I think it's very important, and I think we need to change the narrative that people are going back to, and that doctors are going back to private practice. I think a lot of people get swayed by the narrative that they don't have any choice but to be employed.
So, where do you see the future of independent neurology practices? Do you think there is a good future for it and more neurologists are going to consider it, or do you think that more neurologists are going to be employed?
No, I think there is a good future for it, but neurologists would have to take the lead. Nobody is going to open that for them. Like, we will have to open our practices and we'll have to make it happen. There are hospitals who would be willing to collaborate with you, believe me or not, after you are in private practice. So, but then you do that on your own terms. You do that on your own terms because they need the neurologists to take care of the patients that are getting discharged from the hospitals. There are not enough of them, of neurologists, to take care of all the patients that are getting discharged from the hospital. But when I was employed, I felt burned out. I was not able to enjoy my work. It was not uh, it was not sustainable long term, but now I can sustain it. So I think it's a win-win situation. I think it's a win-win situation for the doctors and the patients.
And do you work part-time or full-time in your practice? You mentioned 3 days.
Initially, I sublease. So when I was subleasing, I subleased for 3 days a week, and I would just do 3 days a week. Part of the reason was I was starting in a brand new area. I had no connections there because I used to work in New York State, and I was starting my practice in New Jersey. So I knew I wouldn't have many patients starting off, so I didn't need 5 days a week office time. So I started with 3 days a week. Now that we have our own space and we can technically we have the flexibility of doing all 5 days a week, but it's my choice to keep my work life balance, and so we still have maintained it at 3 days a week for now. I have a young family, and I do want to be able to spend some time with my kids. So this allows me some time during the week to spend with them as well.
The other question I have, do you think being a woman physician changed how you think about being employed versus private practice? Did that have an impact on the work environment that you had before your private practice and after your private practice?
I certainly felt limited when I was employed. Now, it's hard for me to say if that limitation was because of my gender, because things a lot of times they're very subtle and you cannot be absolutely sure. But I do feel that in my private practice, I do not see any limitation because of my gender. So, yeah, so again, I cannot say if ABC thing was done to me or happened to me because I'm a woman, but I certainly felt limited when I was employed.
But any final thoughts as we're getting close to wrapping up? Any messages to future neurologists or future private practice holders or new graduates, anybody who is considering going down this path?
I think before you decide whatever route you want to go, do your research, like speak with people, reach out. People are happy to answer your questions, they're happy to help. That's what I've learned during my journey. People love helping. And I think when you give them the opportunity to help you, they feel good about themselves as well. So especially when it's easy for them to help you, when it's an easy answer, when they can guide you based on what they have experienced. And people are very happy to talk about themselves and share their experience with you. So reach out to people and then decide what you want to do. And whatever you decide, remember that you could change your decision after 2 or 3 years. You don't have to stick with it for the rest of your life. It's a great teacher. So when you go through it, you learn something and you make your next decisions accordingly.
I couldn't agree more. Yeah, just changing this mindset that you can change things. Basically, if some model is not working for you, then you can move on to a different model, and change this mindset of this is my future here and I have to make it work. And that's not how it should be. And I think people get burnt out because of that mindset, because they feel that they're employed. If they are in an employed model and they think that it's not working out for them, I think they feel stuck and they feel the burnout even stronger because of this mindset. Oh, I have to do this until I retire, right? But if that's not the case and you can explore other options and you have other options to explore, I think that mindset can change.
Right. And sometimes you even think that maybe something is wrong with me. Maybe I'm not able to succeed in this setting and everybody else is thriving, and maybe I'm the person who needs to change, and not the environment. But those things, they can be very self-sabotaging thoughts, that we can entertain at times. Yeah.
Yes, we learned a lot from this actually. I was taking notes mentally. I think I think this is really great to hear from someone who actually did it, because like you guys were just talking about, I think a lot of the times we graduate and we think, okay, I graduate, I work in a hospital, and that's the end, right? And then you find the job that you're in, it's toxic, or whatever else, and you just feel stuck because you're like, what else can I do? There's no way I can open up my own practice or be independent. Like, that's too much work. I'm not a business person. But Shala and I have talked about this before. Like, doctors were very intelligent. Like, the amount of education we've had, I think a lot of these business things, we can figure it out. Like you said, you just have to talk to the right people and ask for help.
Right. Right.
Exactly.
No, and there were independent neurologists who I reached out to. Even they never, made me feel as if I was a competitor and they wouldn't help me. They all helped out.
Well, thank you so much, Sweta, and thank you for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.